Okay, so why do we need a digital health platform? Because the health insurance marketplace is plagued with complicated rules, inefficiencies, and expenses. Whereas the purpose of insurance is to protect against significant and unanticipated economic losses and not to cover routine expenses, some 80 to 90% of all the health care delivered is generally affordable routine office-based and outpatient care. Yet, this tax-assisted insurance-based healthcare experiment has failed to improve overall health or to control costs. And why would you want a health insurance company tell you who you can see and what you can have? Health plan contracts are confusing, provider networks are restrictive, pricing is hidden, and surprise bills are common. Most employers and employees pay more for premiums than they use in services, and most never meet their deductibles. And there are endless barriers to healthcare access that are magnified by delays, denials, and rationing of services. The current healthcare system is highly inefficient, inconvenient, unsustainable, and troubled by fraud. And to work by insurance-based rules, physicians' operational expenses are now at 60 to 70%. So let's look at an easy, affordable solution. An easy-to-navigate book and pay digital health platform can list all office-based and outpatient care work. Again, this represents 80 to 90% of all the healthcare services delivered. Such a digital health platform would eliminate contracts, enrollment periods, restrictive networks, complicated rules, risk pools, referrals, authorizations, delays, denials, rationing of care, coding, surprise bills, and a lot of fraudulent billing. With pricing transparency and priority access, a digital platform would lower employer health benefit costs and put employees and patients in total control of most of their healthcare needs. Additionally, it allows physicians the freedom to practice their profession and slash much of their 60 to 70% overhead. Okay, so let's see how this digital health platform works. So HEALTHdrum is a technology platform that connects patients and practitioners through a smart device, a book and pay platform for routine care that's highly efficient and convenient, and perfectly legal whether you have a health insurance plan or not. To find doctors, visits, tests, or treatments, you simply type in what you're looking for in the search bar. You can choose from the autofill drop-down choices, or you can continue typing in your need and tap the eyeglass. After comparing choices and costs, you make a selection and then tap Book Now. But to go further, you must have created an account. Labs and imaging studies usually require a prescription. So if you're requesting a lab or an imaging study, a prompt will pop up asking you whether or not you have a prescription. You make the appropriate choice and follow the prompts. This pop-up will not come up when scheduling doctor visits. If you already have a doctor, your practitioner would have given you a prescription for the labs or imaging study you need, especially if your doctor doesn't provide those services in their office. If you don't have a practitioner and you're looking to get a lab or imaging study done, you may be able to get a script from a clinic or an urgent care center after visiting that provider. Hopefully one day, patients can request labs and imaging studies independently without the need for a doctor's script. After tapping the Book Now tab, you're taken to the booking page where you request a date and time for your appointment. On the right side of this page, in the web-based version, is a summary of your request with a short bio of the provider, costs of the service, and the location of the service. After completing the requested date and time section, you tap the Next button. This next page is the customer details and payment page. Again, on the right side of the web-based version is a summary of your request along with a short bio of the provider, costs of the service, and the location of the service. After completing the customer and payment details, you tap the Request to Book and Pay tab. Your payment will not be released till after the service is completed. So the next page is your confirmation page, and it also provides a good faith estimate that goes to both you and your doctor of choice. Again, your payment will not be released until after the service has been completed. If you made the appointment request after hours or on the weekend, it is likely that the provider will answer by the next business day. Many physicians and practices will have a practice phone, so whoever's on call will carry the device and may respond faster. Practitioners are keen to favor patients who connected with them through a smart device with fast, efficient service, as the platform cuts their office expenses significantly and delivers fast pay. So now the provider you have chosen receives your appointment request by email. However, the provider has some options as to how to deal with your request. The practitioner can choose to accept your date and time requested or to reschedule you for another date and time and send those details back to you through the platform. Again, practitioners are keen to favor patients who connected with them through a smart device with fast, efficient service, as the platform cuts their office expenses significantly and delivers fast pay. So after agreeing to your appointment date and time, the platform will send you appointment reminders. This page shows the reminders you will receive at 2 days and 2 hours prior to the visit. So after using the Book and Pay platform and you reach the provider's office for the visit, test, or treatment, you can hand the receptionist ID and any personal details requested. However, since this is a cash pay platform and no insurance claims are filed, do not pay copays or provide any health plan details that you may have. As well, you are not bound by any provider network restrictions if you continue to use the Book and Pay platform. If you need to make additional visits, tests, or treatments, you can choose to go back on the platform and complete your request, and you can even do that while still in the doctor's office. So after you visit, the platform will send you an email requesting confirmation that the service was completed and also request a rating. Once the email is acknowledged, payment is released to the practitioner's bank account. The digital health platform solves several problems associated with insurance-based healthcare. It eliminates the complicated insurance-based rules, hidden costs, barriers to healthcare access and delivery, administrative burdens, inefficiencies, redundancies, surprise bills, and fraud. In fact, the innovative scheduling system and payment gateway makes the digital health platform highly efficient and convenient. It puts healthcare decision-making and control back in the hands of practitioners and consumers instead of middlemen, and enables the integration of various other services such as personal medical records and health-related apps. As well, employer and practitioner dashboards can streamline various administrative tasks. So in this video, how useful is digital health? You learned that the HEALTHdrum digital health book and pay platform is highly efficient and convenient for most of the healthcare services you will ever need. To learn more about routine medical conditions, self-care, and digital health, check out these other videos.